Hello, good morning. Thank you for joining us. This breakout session is titled Beyond Mental Health Responders, a Holistic System for First Response. If you have any questions for our presenters, please use the Q&A function on Zoom. Also, if you have any technical difficulties, please email info@mnjrc.org or text 612-361-3951. I'll also throw this in the chat. I'd like now to turn it over to our presenters, Alexander Heaton and Kristen Hitchcock, for today.
Awesome. Thanks very much. Good morning, everybody. Thanks a lot for joining us today. And we're just going to quickly introduce ourselves before we get into the meat of the presentation. I'm Alexander Heaton. I'm a director here at the Policing Project on the Reimagining Public Safety initiative. Came here from the city of Chicago. I worked for the previous administration on police alternatives and arrest diversion. And then prior to that, focusing on specifically substance use diversion with the University of Chicago.
Hi, I'm Kristen Hitchcock. I'm a senior counsel on the Reimagining Public Safety team at the Policing Project. I came here in July, and previously to that, I was at Everytown for Gun Safety for 4 years doing impact litigation in the gun violence space. And before that, I had experience with child and family protective services for New York City and New York State. So I'm gonna get our presentation started.
So yeah, what we do is at the project is we are looking at how public safety is created across the country. We speak with municipalities, organizations, community members, and we really try and get an understanding for what they believe public safety to be, what they believe the role of the government in the creation of public safety to be, and try and help address that mismatch. So our focus is specifically on the public safety within the 911 system, specifically around first response. So starting off, we need to we've acknowledged that we need to reimagine the first response system and the creation of public safety across the country. We know it's not working. We know that it's not centered on what the community needs. We know for substance use, we know that handcuffs are not a treatment option that works for reducing substance use disorder. We know that having somebody with a gun come to a broken down car does not help the car get repaired, does not get the car moving again any faster. So we really need to start from looking at all of these calls for service and going down one by one and asking ourselves, why is this currently a police response? And then we can, from there, we say, okay, who is the best responder to this, if not the police, and why? Most importantly, are we able to get this alternate response to a position where they're available 24/7? The reason why we have police and fire responding to everything is because if you pick up a phone and call 911, within a reasonable amount of time, somebody from the government is going to respond. So how do we get there to these other response options? And then, what are the barriers that we have to implementing this response, whether they be legal? Some states define in law what the police respond to. Some states define what the fire department EMS responds to. So how do we get around that? How do we work through those barriers? And then logistics as well, going back to the 24/7 component, how do we decide what an appropriate staffing model is for these agencies? Having somebody come to work and not have a call may be a question of efficiency, but not having somebody there when you call is a real problem when it comes to safety. So we have to figure out what that balance is in terms of staffing so that we can make sure all of our concerns are resolved. So this gets us to what we call the mismatch. So this is calls for service in a large American city, and these are the percentage of calls for service that are dispatched to the police that aren't necessarily something that we consider the police to be the best response for. And when we say not the best response for that, we consider a number of things. The first one is that the police departments are understaffed. They are responsible for the investigation and deterrence of violent crime. That is their priority. When they take calls, these are the priority calls. And so we look at all of these calls for service, and when we look through these like this, we see a very small percentage of them are actually involved with violence. So things like administrative investigative calls. This could be anything, filling out reports. This could be providing support to another officer who's pulled somebody over. These are things that aren't necessarily creating public safety. Traffic is a big one. So whether they're being stopped for having a light out, or a car accident. When a police stops you for a car accident, they're essentially acting as an agent of the insurance companies. So they're filling out a report and you're sending it on. There's no need to have somebody who is armed or has the ability to detain you there if there's just if you've kind of gone off the road. Once we verify that there's not, you're not drunk, or you're not in a chase or something, there's no need for the officer to be there anymore. So this is a prime example of something that could be moved out outside of that realm. And then the traditional response that we see moving to alternate responders is the mental health calls, the substance use calls. If somebody's having a mental health concern, there's a cultural idea that this person is dangerous and that they are a threat to society. When in reality, this person's having a medical issue. It's like having a heart attack. This person needs to get medical help. And an officer is not the person who's best trained or best suited to provide that. And the same thing with substance use issues. We know that sending somebody away to jail or even prison for substance use increases the likelihood of a fatal overdose. We know that a lot of these jails and prisons aren't providing the services that people need to get inside there. So people are having to go through withdrawals, experience an immense amount of pain and additional trauma inside prison or lockup. And so these are concerns that are better resolved by the community that is trained to help people through their substance use disorder. These are organizations that are in the public health sector. These are organizations that can provide treatment without having to detain somebody and so they can continue living their life. We heard last night about the impact of detention, and it's not just I'm being taken away in handcuffs and now I have a record, but it's things like a job, a home. Do I still have access to my kids? These are all things that get impacted because we have a system that believes that substance use is best treated through incarceration when we know it's not. So moving all of these outside of the criminal legal system will allow the police to focus on the things such as investigating loss of life, while enabling the public health departments to take back on these roles of supporting individuals with substance use disorder. And the final one I'll say on here is alarms. Alarms is a big one, a big mismatch for a number of reasons. But the biggest one is that 99% of alarms that police respond to are accidentally tripped. They're not tripped for nefarious reasons. So in that sense, alarm companies are pushing the cost of faulty systems onto the public, and we all have to pay the price in terms of when you call a police officer for something. The time that it takes them to get there may be longer because they're responding to a faulty alarm system that the company refuses to address. So this is the big mismatch in 911 that we talk about when we discuss this. So these are the kind of things I went through when we spoke about the harms of mismatched response. But number one, we need the police to address things that they are trained to do, that they prioritize. That is the investigation and the deterrence of violent crime. And they can't do that if they are responding to faulty alarm systems, if they're responding to somebody with a medical concern, or if they're writing a report for the insurance company on the side of the road. So that's the number one. That's one issue. The second issue is getting back to this idea of centering the community in our public safety initiatives, is that we're not solving community problems. We're not able to draw a line between some of these issues that the police are involved in and the community being safer. Why is that? Again, because we know that these interventions don't work. And so if we say our concern is substance use, we can't draw a line between handcuffs and better managing substance use disorder. So we need to have our first response built in a manner that has the end goal of the community have their concerns resolved, and the community have their concerns resolved in a manner that they're happy with. And then the final one is unnecessary contacts with the criminal legal system. If you bring a gun to a response, the likelihood of a gun being used at that response skyrockets. It's fairly straightforward. If we reduce the amount of guns on scene that are carried by the government, we reduce the likelihood that the government uses it. And so the risk of that interaction between the public and their government goes down significantly. And we want to make sure that whenever we're providing whenever we're creating public safety in the communities, that we are reducing contacts with the arm of public safety that may bring you into the criminal legal system. And that is the goal of alternative first response, is that it's a safer interaction, an interaction that looks to resolve community problems, and an interaction that leaves folks trained in other things to do what they are trained best in. So now some examples, like how are governments doing this? First off, governments are doing this across the country. This is happening. There are examples of alternate responders that are working, that the community are happy with, that are focusing on results. And I'm going to talk through a couple of them quickly. The first one is the most traditional. It is the mental health first responder. Mental health first responder responds to a scene where somebody's having an emergency mental health incident. It's normally not the person having it who calls, it's somebody who sees it or a family member. And this person shows up, helps de-escalate the situation, and figures out a way for the person to be either reconnected with services they may not be connected to, or just starts building a relationship for them to be connected with in the future. Now, this is the one that we see most frequently across the country, but this is only about 1 to 3% of calls in a given city. So while this is very important, and this is kind of at the heart of most of our high profile, horrible interactions that we've seen that have gone viral, it's a very small percentage of our 911 calls if we're trying to really reimagine first response. The second one, and this is a growing one, really in the South, is the civilian car accident units. Now, this is the opposite of the mental health response. It's not as sexy. It is something that is essentially report writing, but it's a huge chunk of 911 calls. 15 to 20% of a given city's 911 calls have something to do with a car accident. And so by civilianizing this role or moving this role online, for a certain percentage of the vehicle of the crashes, we're able to take a huge chunk of calls out of law enforcement and give the time back to those law enforcement responders, and then instead have a civilian unit responding to these. Obviously, there are going to be some car accidents that are caused by things like DUIs, and that's a whole different story. But for those that are crashes that are not that don't happen as a result of a crime, these are things that we can move out of the criminal legal system and into a civilian responder. The third type is a community service officer. A community service officer is similar to the civilian car accident units, but what they do is they focus on report writing for things that generally aren't car crashes. Some also include car crashes. But so a community officer will respond to things like, hey, if there's graffiti on the side of the building and you just need a report, so that you can send the report in to your insurance company and they can pay for you to get it cleaned off. Obviously, this would be different if it was racist or anti-Semitic graffiti or something that's like a crime that's larger than just the property damage. But for where there are just property concerns, or if somebody's broken into your garage, or if there's been a retail theft incident, they come, do the initial investigation, collect the data, and submit it. And we don't necessarily need an armed responder there. And the final one is online reporting. Online reporting is something that's growing. I think it's something that's really important. The reason being is because, again, for some of these calls where there is where you need to have a report primarily, this is where you can do all of your reporting online from the comfort of your own home. You don't have to wait on the side of the road for a responder to show up. And you are able to you're able to file your reports again without ever leaving the house. This saves time, it saves a lot of money, and it's fairly straightforward. Should I answer questions as we go, or? Okay, so we have two questions in the question and answer. The first one is, are they actually just civilians, or are they trained personnel? When I say civilian in the sense, I really mean just like not an armed sworn officer. So they are trained, they're trained employees of the governments that have them, but they don't carry weapons, and they don't have the authority to detain or write citations. So these are folks who still respond, but yeah, they're not armed sworn members. The second question is, who decides if the car accident is a result of a crime, and when does that occur? So this is something that there's a number of ways this happens. One, if you call and say, like, we've gotten into a fender bender, the city will dispatch the civilian or the non-police responder, the alternate responder. And then they will, if they pull up on scene and they can, smell alcohol in the breath, or there's 100 beer cans in the passenger seat, then they'll say, okay, this is, like, based on their training, like, we believe this is probably as a result of a crime. We're going to call in a sworn police officer for support. Okay, next question. In agreement here, but given our neglect of human infrastructure for decades, how long would it take to create these alternate response teams? Do people really want to do them? It seems like hard and unrewarding work. Yeah, so it takes about 12 to 18 months before you can get your pilot teams on the ground, depending on what they're responding to. Obviously, a mental response has a lot more approvals that are involved, because you have to go through, your local public health entity. You generally have to go through the state as well. So it takes about 18 months to get the first folks on the ground for that. People do want to do them. People are excited to still be able to respond in their communities and to provide support. And it is hard work, but there are folks who are interested in doing this work. When we started in Chicago, we had a ton of applicants for this. So there is quite a lot of interest in it, but I do agree it is very hard work. The last question is for online reporting. Oh, no, sorry, not last question, but for online reporting, how do you ensure reports are accurate? Is there the potential for false accusations? So online reporting has to still go through an approval process. So you submit, and normally there's somebody on the back end who goes through and reviews all the reports, similar to how the police reports are reviewed. There is a potential for false accusations, but in the beginning of all of the reporting, there's an alert or a reminder screen that says that that false reporting is a crime, and this is similar to if you walked into the station and made a false report. I would say that, like, most of these reports are for folks who are at home, who are looking for some sort of insurance, a report to give to their insurance company. So if this is something that insurance would be responsible as well for saying, if I've paid out 100 claims to somebody on their house, then that's something that they would raise. But there's certainly the potential of false accusations, but it is the same as there would be for any other form of reporting. If police, sorry, this is the last question on here. If police were no longer involved in non-violent offenses, it seems like their jobs would be much more stressful. Is officer stress management a factor in developing the system we have now? Do we need to be thinking about how to make the core police functions workable? So this is a question that we get quite a lot, and it is a very important question. And so if our goal here is not to fill up all of the police officers' time with violent responses. Our goal here is to take away the responses that the police are currently going to that don't necessarily require their presence, and to give them that time back. And then that time would be spent rebuilding relationships in the community, and kind of providing a presence in a manner that isn't just going from call to call to call. So in that sense, the hope is that the job would become less stressful because they're not just attached to the radio all day. The last question we have on here, can you touch on the training that would be required to upskill dispatchers to help them safely but quickly determine whether to send law enforcement or a CSO? And can you touch on the union protections that would restrict the implementation of CSO teams? Sure. So whenever we change the dispatch of the dispatch protocol, we go through about a 3-week training process to make sure every single dispatcher has been trained on the question and answers, and if yes, then go to this, if no, then go to this. And it's like a computer wizard as you go through all the questions when you're installing something. And then if you get to the end, then okay, for this person, I will dispatch a law enforcement. For this concern, I will dispatch, a CSO. The most important thing that we do in all this is quality assurance. So picking at random, 100 calls at the end of the month, listening to them, and then working with the training, the training officers or the training staff to say, okay, like we missed this because of that, and then having remedial training. The union protections that could restrict the implementation of CSO teams, we have found that by and large, everybody supports this kind of reimagining efforts. We know that the majority of officers do not like responding to calls on the side of the road for car accidents, and we know that they don't feel comfortable responding to a lot of mental health calls. So if you saw, I'm not sure if you saw a few months back, the union in LA said that they're going to stop responding to 35 call types, and those call types fell entirely within the reimagining work. So I think that answers that question.
Okay, so I'm going to take us pretty quickly through the role that the policing project plays in supporting cities in doing this work. So a little rushed, but I thought it was important to engage with the questions, and I really appreciate the engagement, and also how many times you made Alex say last question. Really, thank you so much. Okay, so we talked about the governments that are doing this work across the country and the ways that the policing project can support governments in doing that work. First with foundational research, and this is really the phase in which we're trying to find what are the unique needs of this government, the city, this municipality. No two cities are exactly the same. And so this involves looking at calls for service data, and seeing like what we can learn from that. What are people calling 911 for? Are people calling and using repeated phrases or keywords that can identify what perhaps an unmet need is? And also, are there repeated categories of calls or repeated callers that can identify gaps in service and an opportunity to address those? Sorry, that just got distracted by, I guess. We also want to, in this phase, engage the community directly and hear from them, like what has their experience been, and what what are their needs that are going unmet. And this doesn't always involve directly, interviewing and surveying, because sometimes that work has been done recently and we can build upon that work rather than fatigue the community by like duplicating the same efforts. And so from there, once we have identified what the unique needs are of the city, we can move on to the redesigning a public safety system, the design and implementation phase, where we're tailoring the system or expanding the system to meet those unique needs. And so this can involve, this does involve technical assistance, which building data visualization dashboards. It's very important that people can readily access information about how their public safety system is working. And this is also where we can help craft policies and also help navigate the legal and regulatory landscape in a jurisdiction. And this is, being an attorney, this is of particular interest to me. And just to talk a little bit high level about how we approach that work, you want to start by like figuring out, by ensuring that you're not going to run into any sort of like preemption issues when it comes to like making policies. And so to do that, you want to figure out what is the autonomy that a city has to create public safety policy. And that's the starting point for that, is determining whether this is a home rule state or Dillon's rule state. And I promise I'm not going to go too deep into that because I could talk about it all day, but basically just asking, is this a government within a state that really they have a lot of autonomy to create policy for themselves, as long as they don't, as long as there's no state law or anything in the state constitution saying that they cannot do this work? Or is this, within a state where you really just have the autonomy to do what state laws or any regulations say you specifically can do. And so once you've identified that, then you can like move forward in identifying the laws that are going to touch on just some big categories that are important in this work. Handling of sensitive data, HIPAA concerns, like that needs to be kept centered to this work, maintaining people's privacy. Transportation, like who has authority to drive city vehicles, and when we're talking about transporting folks to connect them to services, whether it be a traditional destination or alternate destinations, who has the authority to do that work. You also want to know like what regulates insurance and Medicaid, because that becomes like really important in city reimbursement. And as one of the questions like alluded to, like you also want to know like what the city's existing contract obligations are, which can include include unions. And so I wanted to touch on that work because like all of our work is a community of practice, and we are really interested in like building out the legal community of practice. Our public safety systems have looked one way for so long that this really does feel like a new area of practice. So it's really important to have thought partners. Like when we do this work, we make sure to partner with city attorneys, local attorneys who are the experts on like local law. But also, there's a benefit to just sharing with other people doing this work. So if you're doing this work, you're interested, you have questions, you want to talk more, please feel free to reach out, because we're eager to share what we're learning and also to learn from others. And so then moving on to the validating the work piece. This is very important for a couple of reasons. We help connect these efforts to independent evaluation. First, for transparency, these efforts do require a lot of resources, and taxpayers need to see that the public funding is being used efficiently and effectively. And second, we want this work to contribute to the science. Like Alex said, this work is being done across the country, and we really need the benefit of independent evaluators to look in, evaluate the work that's being done, and not just the work that we help cities do, also pre-existing work to validate that this is working and it can be replicated across the country. So yeah, I know I pushed us through that. I hope I didn't miss anything.
No, that's good for me or from the I don't think do we have any questions?
I don't think we have any new questions.
Okay.
So we can go on to the next.
Okay. So let's talk a bit about like how communities can advocate for alternate response here. So there's three ways that we kind of really encourage the community to get involved in once the alternate response programs are off the ground. Obviously, they've been involved from the beginning, saying like we want something other than our like what we have right now. And so the ways that I encourage folks to remain engaged in this is number one is to keep pushing for expanding existing policies. And so what does this mean really? So like when we look at online reporting, there are cities like Dallas have just mandated a ton of calls be moved over to online reporting. And we know when we speak to communities across the country, this is something that they bring up. I don't want to have to call 911 for every single concern because it's the only way that I can get a hold of the government immediately and raise a problem. So expanding existing policies is like, okay, what exists on online reporting? What else can we put on there? What currently do our alternate responders respond to? And what else can we have them respond to? And this is really just like pushing on the folks who are implementing these programs to keep going. You know, when we start a pilot, it's to learn. So like keep leaning on people about this and make sure that like this pilot keeps expanding and it's built into the policy to say, we are going to, you know, every 8 months, every 12 months, we're going to look at these policies and see, is there anything we can get on there that we don't have on there currently? The second one is expanding community options for transport. So when I say this, I mean, a lot of these entities exist within the community already. We know there's organizations within the community that help with folks having mental health crises. We know there's organizations in the community that help with folks experiencing homelessness or with folks who are experiencing substance use disorder. And we know that they can provide help. So we should be identifying and really lifting up alternate destinations within the community that our first responders can transport people to and say, hey, if you're having a concern, maybe you've just overdosed, maybe you need somewhere to go to kind of to de-escalate and to really just like come back down. Sobering centers is a good one for these, somewhere in the community that's not going to give you a record, but where you can go to safely be medically observed while you detox, and then be connected with care as soon as you are able to consent to it. So we want to look and see what's within the community that already exists that can be tied in to the system. And this is huge. You know, when you consider that, obviously we spoke last night a lot about the impact of incarceration on your kind of social determinants of health. But on the other side, the emergency department is the most expensive possible response that you can have to concerns that we know can be resolved within the community. And that's a big part of this work, is connecting people to that last mile. And so, you know, making sure that that's constantly being lifted up. And Kristen touched on this, and I want to touch on it again, as the last bit is validating the work. Validating the work is so important. There are so many of these programs across the country that don't have any evaluation whatsoever. And when we do an evaluation, we're asking the questions like, did it work? Obviously, like, but also like, what does working mean? You know, if you can, were you able to help somebody manage this concern that they had, but in a manner that they're happy with? You know, sending somebody to prison for having a substance use disorder, and maybe they're able to manage it there, obviously is not the best solution. Having somebody kind of manage their concerns within the environment they're comfortable with is the best way. So validating the work at every perspective, including obviously from a medical perspective for medical calls, but most importantly from a community perspective. I'm going to respond to this question we have here. Could either of you address some of the overlap that has been seen between mental health responders and policing, or how sometimes those mental health responders still call in armed officers that cause escalation? Yeah, so this is obviously a concern, right? So we want to make sure that this isn't happening. When we build these models for these alternate responses, these concerns are front of mind. So a big part of this is when we have these mental health responses is asking, is a transport really necessary? Can we provide this de-escalation in the home and not necessarily have to take them somewhere else? Can we take them somewhere? There are programs that work across the country that are 100% consent based. So if the person isn't ready to go, then they don't go. And so how do we look at the balance of this? And obviously, like if there is a safety concern, if there's something happening in the street, but how do we minimize the amount of time that we have to detain somebody, without their consent to transport them somewhere for safety? And we have to look at that every single step of the way. But I think the most important way that we start that is, do we have to transport them at all? Which is something that traditionally happens, again, because of the way our system's set up. You get in the vehicle and you go somewhere else, and it ends the concern. So making sure that we are measuring that so it doesn't happen. The last question we have on here: what cities have alternate destinations? I've read about Cahoots in Eugene and Albuquerque, and the workers felt there was no place to take people and ended up passing out water and granola bars. Alternate destinations, well, there are a number across Texas. We see the Sobering Center is a very popular alternate destination that's popping up across the country. We have them in Denver and San Francisco. There are alternate destinations for folks who can kind of self-transport. We see that in New York with safe use sites. And so the goal of these is that, number one, that like this is a place for first responders to take people. The best practice here is this is somewhere where once you've been taken by a first responder, then maybe next time a friend can take you there, or you can self-refer yourself. And so these destinations are in Chicago. We have triage centers, which are places where you can go that aren't the police station, they aren't the emergency department, and you can be screened to see if you have to go to, or if you want to go to inpatient care somewhere else, in an environment that's specifically tailored for those concerns. So these do exist across the country for various different concerns. And they work. We see the goal here is to resolve folks' concerns, but the way we measure that is to see if we have follow-on 911 calls. And the 911 calls from that person, the contacts with the criminal legal system do decrease as we connect them to for medical causes to like medically run alternate destinations.
Before we wrap up, I just want to backtrack because I do recognize that I skipped over something that's important when talking about engaging stakeholders. Obviously, the community is really important to center in public safety systems that meet community needs. But they're not the only stakeholder. And in doing this work, which doesn't happen in a vacuum, we need to work with city officials, dispatch, and law enforcement. So it's important to engage with those stakeholders as well. And I think that's the information we wanted to share with you. Are there any other questions? If there's not, then I will maybe invite Linda to rejoin us. Linda, we were getting along so well, Linda.
Back.
There we go. Sorry, a little bit of troubleshooting there. All right, are you wrapping up now? Thank you. We have lots of time still, so I'm going to give folks just a few more minutes to see if they have any questions. We have, about 20-ish minutes here still, but I'm going to wrap us up quickly. So thank you again for joining the session. Thank you to our panelists. As a reminder that when this webinar ends, the Zoom app will close from your browser. So go back to the lobby page where you can join the next session then. And if you lost your lobby page, I'm going to throw that chat or that link in the chat once again. A reminder to everyone to please fill out our post-event survey to let us know how we did. The survey will only take a couple of minutes. We'll also throw that link in the chat as well.
Well, I think we got a couple more questions if that's
Perfect. We have time. Yeah. Keep
awesome.
going.
I think I got one here that's cut off. I don't know if you want to re-enter that one. I think half the question was cut off, but I'll answer the second one while you're re-entering that. How do readmissions at some of the sobering centers look like? Yeah, so there are obviously readmissions. So treatment of substance use is like a diet. You know, it's not going to work for everybody their first time. It's going to take multiple contacts, and eventually, you know, folks have to be ready to kind of to manage their substance use disorder. So this is something that's different for everybody. I will say, with readmissions or with contacts with these sobering centers or these alternate destinations, the thing that we look for outside of, you know, how many times you come back is what else are folks being arrested for. And we knew in Chicago for our narcotics arrest diversion program, while we did see folks coming back through the program, we saw a huge drop in things like in the survival crimes that you see. So we saw less people being arrested for retail theft. We saw less people being victimized. And so these are the things where, you know, as people are getting treatment, they are kind of having less contacts with the criminal legal system for other things as well. Are we touting successes enough? See more, we hear more about the failures, people referred repeatedly that victimize or are victimized. This is a great question. And just to kind of like go back to this, you know, is that the way we tout successes is through evaluation. So we can tell stories about kind of like one-off instances and things, but what we really need to do is to lean on our policymakers to say, is this being evaluated? Who is your independent academic evaluation partner? So that we can start kind of getting the word out that this works. And if it doesn't, so that we can get some suggestions for how to make it work better. What resources are there for smaller communities working on this? My community is approximately 20,000, and there seems to be no statistics, data, and resources for smaller communities. So as we worked on this in Chicago, we did this district by district. So, you know, Chicago is a city of villages. We did this in a district of between 40 and 60,000 people. So this is something that is entirely doable. It's scalable to the smaller municipalities and the larger ones as well. So, you know, if this is something that you're interested in doing in your own community, I think you need to kind of figure out where the data is held on these sorts of calls. It's normally held at like a public health agency. You want to get 5 years of that to see what you're looking at. You want to speak with your first responders to see kind of how this would fit in there. And we're happy to help you work through that. So this is definitely something that we can assist with. What were the other forms of calls that could be diverted from police? I saw mental health and responding to civilian accidents and was trying to write them all down and missed the last two. Yeah, we are happy to send, we can send over the full list to you, if that's helpful. While I know that most of the alternate responses are for nonviolent situations, is there a viable model for alternative responses to domestic violence and domestic disputes? So yeah, this is something that the entire field is really working on right now, is like how to create a response to a domestic incident. And this is really tough, right? So I think what the focus right now is like the follow-up and what happens with the follow-up, how to move the follow-up out of policing into local agencies that work with DV victims, and also looking at kind of emergency rehousing, and things that don't exist across the board right now, and trying to put those in place. Like housing is the big push for this. Immediate housing for victims and for victims and their children. If a person repeatedly refuses to consent to help, can there be something coercive at some point, especially if the person is vulnerable? Yeah, this is part of the kind of like, as you're building the system, this is a question that is very important to answer. And it's figuring out how to transport somebody against their will in a manner that doesn't result in their obviously, like, their death is the worst possible outcome. And so this is why some cities haven't gone use a 100% consent model. It's okay, can we get this person into a vehicle with the assistance generally of the fire department? And so this is something that's built in, but again, like how to do this in a manner that is the safest for everybody involved, centering obviously the person with the concern. Are there any more questions that folks? These are great questions. I appreciate everybody asking these. Does anybody have anything else that they want to ask while we're here together?
I think that, if we have time, let's hang out on the call for like 5 more minutes and let folks, throw their questions in the Q&A. Otherwise, I will be ending this breakout session at 10:25 then. And then it'll be a hard stop for us, and then it'll just end it for all participants. Alexander and Kristen, if there's somewhere where we can find your information, like a link, a website or something, if you have a PDF of your report, that would be fantastic if we can share that with the audience.
Yeah, I think I cut us off before I got to our QR slide. So one
Oh,
sec.
sweet. Okay, great.
There you go.
Yeah. So if anybody has any questions or anything that they want to ask more about, this is the QR code to my contact info. So reach out and we will be more than happy to chat further with you. And also our website is safetyreimagined.org. So come over, have a gander, see what we're working on, and yeah, we'd love to chat more with folks. We got a couple more questions while we're here. Minnesota already has some of these communities forming together. Do you know their names if there's already groups? I do not. We're still learning about what's happening here in Minnesota, but I can have a look for you, and I can connect you with anything that I find. Have alternate response teams reported rates of being assaulted by clients? So I'll answer say that, like, for the most part, these alternate response teams are able to respond to calls without having to ask for any sort of backup. In Chicago, when the program started, we had one incident that happened, and it was an incident that happened because there was somebody experiencing a mental health concern who was flailing. It wasn't necessarily somebody who was targeting an alternate responder. So I will say that, like, these folks are professionals. They've been highly trained in this. They come a lot of times from backgrounds of working in the mental health space. And so they're able, they are specifically trained in de-escalation. So they're really able to maintain that positive interaction in the community. Next question. Can we talk more about funding models? Oh yeah, I love this question. So right now, most of these programs across the country are run in pilots. So they're funded with a combination of foundation money, with COVID money, with some budget from the city. Ultimately, if this is to work, these programs are going to have to be able to bill the state for reimbursement, similar to how most fire and EMS departments work. But yeah, this is going to have to be something that's built in to a longer term funding plan, similar to police and fire departments. We need to consider this as a fourth option for emergency response for first responders and build it in similar to that. I will say that like there is going to be enormous savings that are realized by the hospitals through reducing the number of kind of high frequency utilizers that are taken there. We're going to have reduction in kind of misconduct payouts as you have people who are responding to calls that are trained to do this. But we are ultimately going to need it to be funded similar to any other government agency is funded right now. Is the policing project a combination of students and volunteers? Do you do evaluation for groups, or do you help people find evaluators in a location? So it's a combination of students and full-time professionals and professors. So we are both full-time on the policing project. Do you do evaluations for groups, or do you help people find evaluators in their locations? Both. So we do, we've done a lot of community conversations where we go out to cities across the country and speak to all of the stakeholders, from the community to the policymakers to first responders. But for these evaluations of programs that exist already, we have partners with academic orgs across the country who we partner with to help them, come in and do the evaluations. And this is the reason we do this is because our goal is to help cities improve on their policies so they can better respond to the needs of their community. And it would be inappropriate for us to evaluate our own work. It wouldn't be considered independent evaluation. In Minneapolis, some response workers worry they'll be viewed as cheaper cops. Has that come up? They are paid much less than police. So yeah, this is in Chicago, we hired them. I think here they are, it's a contract organization. In Chicago, we hired them on as full-time staff. So there's different ways that full-time city staff, excuse me. So there's different ways that folks are employed across the country doing this. There's a mix of contract staff and of full-time staff. So the pay varies from city to city and state to state. I will say that in Chicago, it's a union city, so their pay is I'm not sure if it's less. I know it's not significantly if it is because of their union representation. This work must involve, the next question is, this work must involve collaboration with current police. Are there best practices for how those interactions are best structured? Sure. So there's a number of ways that we structure the interactions with the police. One is once we start dispatching these alternate response units as the primary responder, that's not the only way that they can go to these calls. So if a police officer responds to a call for, here's an example that we see a lot, somebody punching cars. Somebody punching cars is a property crime. So the police are going to come out, and if they come out and see, this person is experiencing a mental health crisis, I don't necessarily think this is just a property crime. This is a symptom of this mental health concern. I'm going to call the response unit and have them come. And so that's the second type of way that they are connected with the community. The same way is like the on view stuff. So an officer may be driving by and see something that's happening. Hey, there's somebody who's displaying symptoms of some sort of a crisis. I'm just going to say, hey, can you guys come over to this corner and have a look here? This might be something that is best suited for you guys. And that's another way that they work together. And it goes the opposite way as well. If a mental health response, similar to the fire department, if they come to a scene and they're like, this is unsafe, we're going to back up off scene and make an announcement that we think this is unsafe and we could possibly use some police support. And so that's really how that relationship works. So these guys are working together as, like I said before, they have to be considered as first responders, as part of the team, similar to how we see police and fire currently operate.
This last one's not a question, but a very helpful feedback. Thank you very much.
Yeah, I hope this has been really helpful for everybody. Obviously, we are super passionate about this work. We're always up for questions and to kind of discuss your local situation and to see if and how we can lend our support to it. I hope this has been useful for everybody today. We appreciate your time.
Thank you, y'all. Again, there's a link in the chat if you if you lost your landing page. I'm gonna throw it in once again. That's how you get to your next session. Sweet. Okay, I'm gonna close this out. Thank you so much. We'll see y'all in other breakout sessions.
Thanks, everybody.
Thank you.